shall leave the light and lead a path to wisdom. Our will to be our light. To those in pain and suffering, we shall hear a call. With arms to care and comfort, compassion above all, to face a brighter future, bound in unity. The Philippine College of Physicians, we shall be hand in hand, building a stronger nation. This
The Philippine College of Physicians, through the Committee on Media Communication and Health Forum, presents its bi-monthly lay forum to promote the advocacies and mission of the college and its component and affiliate societies. An avenue of accurate and up-to-date conversations with the media and the general public, with timely and diverse topics covering vital public health and medical information, straight from the experts. In a platform that is convenient, accessible, and highly engaging. Welcome to the PCP Health Forum.
No sound.
Hey, good morning, everyone. Good morning to my fellow members of the Philippine College of Physicians, my fellow co-health workers, to our media partners, and to all the guests attending in this webinar and FB Live activity. Welcome to today's Philippine College of Physicians First Media Communications Health Forum for the current fiscal year of the 2022 to 2023. We will be having more of these health forums to come in this coming year. So hopefully you could also not just join us here, but also join us in the upcoming sessions. I am Dr. Kat Tuhino, a fellow of the Philippine College of Physicians and a current member of the Committee on Media Communications of the PCP and the moderator for today's health forum. This morning, we are tackling a re-emerging infectious disease that has been raised as a global health concern due to its increasing cases in non-endemic areas. This condition is what we know of as monkeypox. So in 1970, monkeypox's first human case was identified in the Republic of Congo, and it spread in the rural and rainforest regions of the country. It has been subsequently reported across Central and West Africa and also has been recognized in other African countries. Outbreaks in these countries were observed among infected animals imported by travelers from other endemic areas. However, in May 2022, in this year, monkeypox disease was raised as a global health concern when there was a reemergence. And it was identified in 12 non-endemic countries such as the United States, UK, Canada, and some European countries. Due to its reemergence in these non-endemic countries, the risk of monkeypox to be spread has been real since, especially in our country also, since we are open to tourists from these countries who have been identified with new cases of monkeypox. So, good morning. and welcome to our health forum entitled Monkeypox, an in-depth look. To formally welcome us in the health forum, I would like to introduce the current president of the Philippine College of Physicians, who is also the professor and chair of the Department of Internal Medicine in the Fatima University Medical Center in Valenzuela and Antipolo. She is also the chair of the Hepatology Committee and section of gastroenterology in Cardinal Santos Medical Center. And she's also the past president of the Asian Pacific Study of the Liver, Philippine Society of Gastroenterology, and the Hepatology Society of the Philippines. It is my privilege and honor to welcome our dear Dr. and Professor Diana Payawal for this session's welcoming remarks.
Magandang umaga po sa lahat ng ating kaibigan sa media, mga viewers natin, and of course, ang ating resource speaker para sa Health Forum ngayong umaga. First of all, let me thank you for being with us and helping us push our vision of improving healthcare through information dissemination. Earlier this year, monkeypox came to our attention. Just to reiterate that the virus is our enemy. And while this virus is not new, it was immediately a cause of alarm as the world is still reeling and worried from the seemingly endless misery of COVID-19. Unfortunately, another virus causing outbreaks in several African and European countries is not something to be ignored. And recently, the United States has reported on the increasing number of cases in their country. More than 11,000 cases have been confirmed worldwide across 55 countries. And so we hope that this health forum will be an opportunity for us to familiarize with the risk, identification of the virus early, prevention, and be guided on what to do in case we are brought forth a patient with the virus or we get infected with it. So again, I would like to thank our resource speaker, Dr. Regine Solante, the Vice President of the Philippine College of Physicians, for giving us his time and sharing us his knowledge. This is an essential campaign that we should inform and disseminate to the public as healthcare providers. Again, let me thank, of course, Dr. Ginger Samonte for spearheading the media campaign. Thank you and enjoy the morning.
Thank you, Dr. Payawal, for your message and warm welcome. And again, welcome to today's first health forum of the PCP. So now we have entered the lecture proper of this health forum. And before we start, for rules, may we remind our participants and attendees that you may write your questions in the chat box during the lecture proper so that we can answer these questions later in the Q&A portion. So for our speaker for today, he is the incumbent Vice President of the Philippine College of Physicians. He is also the PCP's Distinguished Healthcare Advocate in the 2019, and he is the past President of the Philippine Society for Microbiology and Infectious Diseases. He is also the current chair of the Adult Infectious Disease and Tropical Medicine in San Lazaro Hospital. And he is also a current member in the Vaccine Expert Panel, the Technical Working Group for COVID-19 vaccine trials. Without further ado, let us all welcome Dr. Regine Solante to give us an in-depth look on monkeypox.
Thank you, Kat. And thank you also to our president, Dr. Payawan. Okay, can you see my slides?
Yes, Doc. Yes.
Okay. So first of all, this is the initiative of the Philippine College of Physicians, ECFICOM, and board, that we want to widen our awareness on emerging infectious diseases. So we will be having a series of these infectious diseases in the next weeks to come. And hopefully we can also help disseminate this important information about these different infectious diseases. Now, for this morning's discussion, we'll take a closer look on the monkeypox. How is it now in non-endemic countries, the clinical manifestations, how we should be able to detect this, and what are the preparations that most countries, including the Philippines, are in place just to make sure that in the event that the case will be documented, then each of us, including the healthcare facilities, will be ready. But just to say, it's important that the community, the common people, should really know what is this monkeypox and be able to create awareness on how to know some of the important things about monkeypox. So monkeypox, as we all know, is endemic in this particular region of the world. This is West and Central Africa. And this is a virus which also included some of the more highly transmissible virus in the past, like your smallpox, no? But this smallpox has already been eradicated because of the massive vaccines. And currently, this infection is quite natural in this region. And the common manifestations of monkeypox is like any other infections, no? But the most characteristic here is the presence of yung rashes, and then you have lymphadenopathy. Most of the time, it is mild, and the case fatality rate range from 3 to 6%. Okay. So this is the map of most of these cases that are being documented. And for the past 10 to 15 years, there are also cases that has been documented outside of these regions, no? And these are also brought by people who has had infection and had traveled in these particular countries and infected those in the area that they are residing, which are non-endemic for monkeypox. So just to give you a review, how this monkeypox usually comes in and how does an individual or a human being develop the infection, okay? There are animals that are known to be infected with this monkeypox, and particularly common only in this region of the West and Central Africa. And these are your African dormouse, you have your Gambian pouch rat, then the Sooty Mangabe monkey, and then the Rope's squirrel. But you know that in this region, one of the important hobbies of most of these children and people there is really hunting animals for food, okay? And that's why in most of the cases, either the human got the infection through contaminated infected animals or contaminated animal products that usually are uncooked or unclean and exposing these people. Now, secondary infection, which is a human-to-human, which rarely occur in this setting, when an individual will already have the manifestation, okay, all the classic manifestation of monkeypox, like fever, and then the appearance of the rash, which also heralds the onset of more virus in the body. And this man will also expose other individual in the form of close contact, okay, including respiratory contact. And that's why it will start the secondary human-to-human transmission. And it can also be transmitted from the mother to the baby, especially for those mothers who are exposed and infected. So this is the cycle of how from an animal, the virus can be transmitted to another human being, and then that human being can transmit it to another human being. Now, this is the classic picture of some of how this virus are transmitted and currently circulating in this part of the region in West and Central Africa. They are fond of trapping, hunting, and handling these animals. Okay, you see here children bringing this animal, hunting this animal, and also selling these animals, which are potentially infected with the virus. Okay, and that's where the difficulty in really controlling this monkeypox infection in that particular region. Now, fast forward the past 3 to 4 months, several of these WHO regions have been reporting cases of monkeypox. And in fact, in this latest WHO report, there was an increase in around 41.6% of reported cases globally in the last 7 days. And these are the regions outside of the African regions, 60% in the Western African region, 50% plus in the region of the Americas, and 38% in the European region. So these are some of the countries that are being currently having this case of monkeypox that are being documented and confirmed. Okay, so just to be elaborate about this, from January 1 to July 7 of 2022, there are already 7,892 confirmed cases in non-endemic countries. Okay, and that also includes 3 deaths that were documented in these countries. And 65% of the cases reported, which amounted to like 4,900 plus, are reported in 26 European countries. So this is really higher number of cases documented in European countries now. And these are the breakdown of the cases, 82% in the European region of the Americas, 15%, African region, 2%, and then you have Western Pacific region, less than 1%, together with that of the Eastern Mediterranean region. Now, what is the characteristic of most of these cases? We need to specifically elaborate this because there are atypical presentations of these cases, because the mode of transmission of the current monkeypox is quite different from that in endemic countries, where in endemic countries it came from an animal, but this time there is a human-to-human transmission. And in fact, among those, the demographics among those in the non-endemic countries, most of those that are infected are males, 18 to 44 years old. Okay, and in fact, there were 7 cases that have been reported under 18 years of age in the European and African regions. And 98% of the cases were identified among men who have sex with men, or MSM. And 41% of these are HIV positive. So which means that the exposure here are brought about by social events, including sexual contact among this population. Okay, but not to stigmatize this population, it's more of really higher risk because of the unprotected sex. There are also 113 healthcare workers that have been confirmed with this monkeypox. But whether the infection in these cases are caused by occupational exposure, that we don't know yet. So these are the confirmed cases in all of these WHO region as of July 7, according to the date of symptom onset. Okay, so which means that from the time that it has been documented in this region, most of these are in the European region. And if you look at the symptom onset, there are those that more cases that's been documented the last week of June. Okay, so we are the WHO is still monitoring the cases because of the higher number of these cases being documented during this time frame. Now we go to the clinical presentation. How does this differ from that of the non-endemic countries now? So if you look at this clinical picture of a classic monkeypox infection, usually starts with fever, and then you have lymph nodes, swollen lymph nodes, and then you have eruption of your rashes, which is in a centrifugal manner. Okay, so this is the classical type of how the monkeypox usually will present. Okay, and just to give you an important overview here, incubation period from the time that the individual was exposed to a monkey or to another human being that is carrying the virus. And then after that febrile stage, you have 1 to 4 days. And then after the onset of the febrile stage, it will follow the appearance of the characteristic rash. Okay? 2 to 4 weeks, lasting 2 to 4 weeks, and then recovery thereafter. Now, this is the common presentation based on this WHO data, that the most common is the presence of rash, then you have fever, headache, pruritus, and then lymphadenopathy, okay, in almost around 70% of the cases. Then the other symptoms, you also have oral ulcers, cough. Pneumonia is one of the complications of this monkeypox virus, especially among those children and those who are immunocompromised. And then you also have gastrointestinal manifestation in the form of vomiting and nausea. And WHO also have some way of looking at it in terms of severity. And one of the important clinical points of severity is the number of rashes. Okay, so which means that rashes, if there are more than 100 rashes in the body, then that is considered a severe infection. And only less than 50, you have mild infection, and then you have subclinical infection, which means that at times you may not suspect that this is a monkeypox because the rashes will only appear like a postural lesion and are not fully distributed all over the body, distributed only in a localized area of the body, either in the arms or in the extremities. But what is the current clinical presentation of monkeypox that has been experienced in non-endemic countries? Okay, one is that the skin lesions are a lot fewer compared to the original or the classic monkeypox. And in fact, there are those who have a single lesion, okay? Just like in this particular pictures, which was grabbed from the European data, okay? Which most of the time, it's not, you will not suspect that it's a monkeypox type of rashes. And in some patients, skin lesion is absent, but there is anal pain and rectal bleeding, okay? There are also lesions in the genital or perineal or perianal area that do not spread to other areas of the body, okay? So this is the genital organ with this particular rash. And that's why, if you'll notice in the cases that were gathered in most of these European and US countries, most of the cases were documented and traced to a sexually transmitted infectious disease clinics or an STD clinic. The other different manifestation here that is atypical is the appearance of the lesions before fever, malaise, and other systemic symptoms. So which means that baliktad, no? Nauna ang mga skin lesions over that of fever. While in the classical monkeypox, usually it starts with fever and before the appearance of the rashes. Now, in terms of gathering the most common lesions among 3,683 cases based on the WHO report, any rash, so meaning any appearance of the rash, any part of the body, then you have systemic rash all over the body, and then this is followed by fever in only around 45%, okay? And then you have genital rash, lymphadenopathy in 30%, and then you have local lymphadenopathy, fatigue, muscle ache, and headache, okay? I will give you an example, no? One case that was presented in one meeting, okay? And this is a 32-year-old male who is an MSM, an HIV positive with a controlled on antiretroviral treatment with a very good CD4 count, and complaining of proctitis, no, or pain at the anal area. 3 days after, he had onset of rash, which appeared like this. This is in the trunk, this is in the face, and this is in the arms. No? And you will not really suspect that this is monkeypox. There is associated sore throat and rectal pain, and there was progression of the rashes. No? So this patient was went to an STI clinic and treated for gonococcal infection or a sexually transmitted infection. But with a partner that recently hospitalized in the US, diagnosed with monkeypox, they did an RT-PCR on this lesion, okay, in a dry swab, and it turned out to be positive. So this is one example that it may not appear just like a classic manifestation, just as an unsuspecting of a possible rash. Another patient, 50-year-old male, with no history of smallpox vaccination. Why? Because they always elicit the history of smallpox vaccination, especially for those 50 years old and above. No? And this is also MSM with a very good CD4 count, sexually active, and then this time no travel and no history of contact with the known monkeypox infection. So this patient doesn't have any symptom, but only complained after that, complained of myalgia, malaise, and fever. Okay. Then there was painful perianal lesion, and there was also pain in the anal area. Okay. So these are the skin lesions. No? Then after 2 to 3 days appearance of this lesion, there were also papulopustular lesion in the face and the legs, and then abdomen. Okay, so again, this is not so many lesions, less than 50. So they did a blood RT-PCR, including a swab RT-PCR, and it turned out to be positive for the virus. Okay. And then in 2018 to 2021, there were also a report from the Lancet of specific patients that were traveling or did not have any history of travel to Western and Central Africa that were diagnosed with monkeypox. And what were really visible here are the different lesions that somehow are not characteristics of a monkeypox. No, one here is the vesicular lesion. There were also lesions in macular lesions in the palms and soles, and in fact, these two lesions can also be found in patients with syphilis. Okay, so that means that if you are not really keen on looking at this, you may be treating this patient as having syphilis. It also appear with the pustular lesions and the subungual lesions in the nail, and then you have papules and smaller vesicles. Okay, and it also presented with a deep abscess. Okay. Again, another view of the different rashes. So this is just to tell you that the appearance of this rash may be really atypical and not the classical type of rashes that we've seen. Okay? And then another report here, observed in May to June, there were also rashes that appear like umbilicated small lesions and rapidly progress through different stages of the appearance, from a papule to vesicles, pustules, and scabs. Okay. So the current challenge now is the atypical presentation of these lesions, by which most of us may not be familiar with. Okay. The fact that there are no prodromal symptoms to start with, and the appearance of the rashes, so meaning there were no fever, malaise, and headache, and just the appearance of skin lesions, especially at the point of sexual contact in most of these patients, strongly suggests that there's also possibility of sexual transmission. So through sexual transmission, they acquire the infection. So what is the most common mode of transmission now identified among these individuals in non-endemic countries. Okay, so the most common mode of transmission is the human-to-human transmission through close physical contact, through sexual networks, and this is one thing that we might have to look at in terms of who are the risk group that usually are commonly getting this infection, which is also the important communication that most of these countries are looking into in terms of prevention and cutting the risk of transmission. Although there are data to suggest that when they did analysis of genital fluids among these patients with monkeypox virus, they were able to identify the presence of the virus, but it's still not definite yet that the presence of this virus in that genital fluid will really is equivalent to evidence of infectivity, including that of this virus. Now, who are at risk for severe infection? Okay, so there are people that always at risk for severe infection, whether it's the classical or or those in the non-endemic countries. One of that are those people who are immunocompromised, okay, especially the HIV individual with low CD4 count, those who are pregnant, okay, those who are in the extremes of age, especially the young children and the elderly, and those who are immunocompromised population, like patients who have transplant or post-transplantation, cancer patients receiving chemotherapy, and those receiving treatment with immunosuppressive therapy. So what is the risk of further spread of this monkeypox? So in a way, we need to identify specific population as part of really looking into high risk for getting the infection based on the experience of these non-endemic countries. Okay, and most of the article and most of these countries are really looking at the high risk population. One of these are those persons with multiple sexual partners. Okay, and precisely so, they are this population because in the data they are the 98% of them had multiple sexual contacts, no, among those monkeypox virus infected in non-endemic countries. Okay, so these are what we call the MSMs, those with multiple casual sexual encounters or attending social gatherings. So significant percent of the cases, okay, among those that were detected among people with HIV, mostly not on antiretroviral treatment. So it's important that the more immunocompromised, the higher is the risk of getting the infection and with those risks of mortality. What about for the risk for the broader population? Okay, so most analysis among the broader population risk of transmission is really low. Okay, so the overall risk for the general population is considered low, and lower, especially for those age 60 years old and above who have received smallpox vaccination in the past. No, so which means you still have that level of immunity that you can be protected with this monkeypox, and this is some of the agreements of some of the experts. But there is always the potential that the transmission to this broader population will also be possible, okay? Especially among specific population where you have higher risks of protecting yourself because of immunocompromised conditions, such as the young children, pregnant women, and those who are immunocompromised individuals. Then the next group of risk will also be from the frontline healthcare workers, of course. No? So being in the front line looking patients, seeing these potential patients having getting the infection, where the importance of always observing the use of appropriate personal protective equipment, especially when handling patients with fever, handling patients with rashes. Okay, For all you know, you don't know, other infectious diseases can also be transmitted through the droplet or direct contact, and that's why it's important that as healthcare, we are seeing patients, it's important that we use the appropriate personal protective equipment. Although in the current outbreak, no cases of transmission to health professionals through occupational exposures have been reported to date. Okay, so that's a good sign. So, but again, we have to create that important awareness. Now we go to the diagnosis. How do we diagnose a monkeypox infection? Okay, so the confirmation of the presence of this virus is with the use of your RT-PCR, okay, or your polymerase chain reaction is the preferred laboratory test. Optimal diagnostic samples. So what are the samples that are important for us to diagnose this? You use the skin lesions or the roof or fluid, no? Of if the skin lesion has vesicles or if it's pustular, okay? And you can also still use the dried skin lesions, the dried crusted lesions. And then samples must be stored in a dry, sterile tube and kept cold. Now, in this WHO data, the testing is really important, no, to document the presence of monkeypox. Okay? And in some countries, there are testing modality aside from the RT-PCR. And this is where timing of testing is also will have value in order to maximize the yield of a positive test. Okay, so there are also RT-PCR for oropharyngeal swab for monkeypox, and usually this is done during the febrile stage, wherein you still don't have the rashes. Okay, so using a tonsillar and nasopharyngeal swab, you can use this particular test. Although I don't think it's yet available here in the Philippines, but in other countries they are using this one, RT-PCR, tonsillar and nasopharyngeal swab during the febrile stage. So meaning before the appearance of rash. Once you have the rash stage, where you need to get samples from that, then you can also do an RT-PCR. There are countries who have developed already an antigen detection method of this monkeypox, and that's also an alternative test. But this test is not available yet here in the Philippines. And during the recovery period, wherein no more symptoms has been documented, but you have probably your past symptom, an antibody action method can also be used, no? Although the sensitivity and specificity are very low. Okay, so I would just like to share with you here this May 24 department memorandum, from the Department of Health, wherein the important implementation of surveillance, screening, management, and infection control. So this is the document that somehow are important for us healthcare workers and healthcare setting in order for us to prepare ourselves in terms of if there will be cases of monkeypox in the Philippines. So I would like to share here that there are specific case and contact definitions from be part of that. And one or more of the following signs or symptoms: presence of headache, fever, myalgia, back pain, asthenia, and lymphadenopathy. And more importantly, for which the following common causes of the acute rash do not explain the clinical picture. So meaning the rashes are not typical of varicella, herpes zoster, measles, herpes simplex, bacterial skin infections, disseminated gonococcal infection, primary or secondary syphilis, chancroid, LGV, and all the other types of rash. Quite difficult because an ordinary for us, whether it's varicella or herpes, although this may be characteristic in most of the patients, but when you are there in the clinic and you have a patient with rashes and you have all of these manifestations, then what the important trigger here is you always have to suspect if it's a monkeypox. But first, you have to rule out the more common cause of the acute rash rather than jumping and diagnosing this as a monkeypox, especially without history of travel or without history of contact from an individual who have been diagnosed with monkeypox abroad. A probable case is a person meeting the case definition for a suspected case and one or more of the following. So meaning if that patient had those manifestations as a suspected case and there was an epidemiological link, so meaning there was face-to-face exposure of an individual diagnosed with monkeypox, including healthcare workers without respiratory protection, direct physical contact with skin or skin lesions, including sexual contact or contact with contaminated materials such as clothing, bedding, or utensils, to a probable or confirmed case of a monkeypox in the 21 days before the onset of symptom. Okay, so this is an important part of this criteria where there should be probable or contact with a confirmed case. Or there was a reported travel history, so that individual had manifestation, and then there was a travel history to a monkeypox endemic country in the past 21 days before the onset of symptoms. Or that individual had multiple sexual partners in the 21 days before the symptom onset, or that individual is hospitalized due to the illness. Okay, so that is the definition of a probable case. And of course, patient that is confirmed, when the patient has been, the lesion has been confirmed with the presence of your monkeypox through the accepted diagnostic modality, which is the RT-PCR. Okay. Now, in this document, it somehow also elaborated the importance of the high index of suspicion. Okay, and this is also elaborated that any individual who develops skin lesions such as macule, papule, pustule, vesicle, accompanied by fever, intense headache, unilateral or bilateral lymphadenopathy, back pain, myalgia, shall contact their healthcare provider for risk assessment and diagnostic evaluation. So this is where that we need to inform our patients, we need to inform our in the clinic the importance of really awareness of this clinical manifestation, that they should also contact the doctor or any health work provider in the community. Or any individual who develops skin lesions during international or upon to the country shall immediately report to a health professional and provide information about all recent travel history, including sexual history and the history of smallpox immunization. Okay, so any individual who is a suspected or probable case of monkeypox shall undergo home isolation. So once you are declared as suspected or probable, then you have to isolate at home or until there's a resolution of all the symptoms, including any rash, crusting, or scabs, and observe appropriate infection control protocols. But again, it's important that there should be a direct and close monitoring and communication with the doctor, especially for those who have been consulting their doctors or admitted in the hospital. So this is just the view on how the case investigation form will be. Okay, and this is the case investigation form in terms of the case definition. And these are the way of handling the specimen that will be submitted to the Philippine Genome Center and RITM, and these are the specific samples and schedule of sending it. Okay, treatment. Are there treatment for this monkeypox? Okay, none for now. No, although there are antiviral agent that has been used in countries reporting this. In non-endemic countries reporting this monkeypox, but mainly the treatment is supportive. So which means that pag may lagnat, paracetamol, you have to rest, you have to hydrate, okay? Because hydration is important because of the rashes that sometimes can be pustular. And use of antipyretics, use of anti-inflammatory agents because of the pain, and then increased oral fluid intake will also be beneficial. Currently, here in the Philippines, there are no antiviral or immunoglobulin treatment that has been locally approved, no? And for the treatment of monkeypox by our own Philippine FDA. Okay. In other countries like Europe and US, they are giving antiviral agents that are considered potential treatment also for monkeypox. And all of these drugs have been used with patients with smallpox. No? So these are some of the examples of antiviral treatment which is not available here and licensed here in the Philippines. Vaccines. Vaccines is an important component of controlling the infections. Okay, so if you have smallpox before, smallpox vaccination before, then you have been, the estimate is that you will still be protected 85% against getting the monkeypox. No? And that's why most of the cases documented in non-endemic countries are in the younger population. Okay, but currently there are two vaccines approved. No, in 2019. One is the Jynneos vaccine, which is for the prevention of monkeypox, and then the other one is the ACAM 2000, licensed also for the prevention of smallpox, but data are telling us that it's also effective in the prevention of monkeypox. So currently, most of these countries are giving this among those who are high risk, okay, like laboratory and healthcare personnel with higher risk of occupational exposure. So this can be given as a pre-exposure prophylaxis, okay? But in other countries also, they are now giving this as a post-exposure prophylaxis for persons who have had high risk or intermediate risk exposure, okay? So there is limited stocks of this vaccine and it's not readily available, but this is one intervention that vaccine can also be an important part of prevention and to lessen to cut the chain of transmission. Okay, so just to give you here, there are 4 generations of vaccines for smallpox and are currently being used now for monkeypox. No, and the one that is being used in most countries is the 3rd generation vaccine, the Invanex, which utilizes 2 doses of this vaccine 28 days apart. Okay, so this is my last slide. What are the key for the effective control of this outbreak that has been always mentioned in most of this country response? First is the early diagnosis, creating awareness on how monkeypox will present, what are the common clinical manifestations, okay, and reporting to the authorities for diagnosis so that there will be subsequent isolation of the patient. So it's important to isolate the patient to prevent further transmission. And part of the effective control is also contact tracing. So tracing all the contacts, especially if that particular individual is a suspect or probable or confirmed with monkeypox, important to contact trace all individual with close contact with the index patient. Vaccination strategy is an important part of this, and government should also now be looking at how we can have vaccines in preparation, just in case if there will be monkeypox infection that will be documented here. We always put importance on increased awareness on this. And part of this is the Philippine College of Physicians' responsibility to put premium on awareness and how to prepare for this. Okay, I showed you testing recommendations. Infection prevention and control is part of that. In the healthcare setting, we must be ready with our isolation rooms. And I think our lessons learned with the COVID-19, with the ongoing COVID-19 pandemic, will teach us additional lessons with these emerging infections. And what we have now is the monkeypox, okay, and including public health measures. With that, thank you very much for your kind attention.
Okay, thank you, Doc Jean, for the informative as well as comprehensive update on monkeypox. I'm sure everyone has been more knowledgeable on this. And so for anyone who has questions, actually, we have already questions in the chat box. You can still type in the chat box if you have any questions. But sir, so we'll proceed with the Q&A, if okay with you, Doc Jean. The first question that was asked was, are there already reported cases of monkeypox in the country or in our neighboring countries, if at all? Meaning, in our neighboring countries, are there already reported cases na po, Doc Jean?
Yes, I think it's in, if you call it because we are in the Western Pacific region, no? So it's Australia and South Korea are the two countries that have had reports of monkeypox. But so far in our countries, I don't think we have one. And for now, hopefully it will not enter into our country.
Yes, at least, Doc, good news niya na wala pa tayong cases in our country, no? So, just in case, Doc, you've already told us about yung DOH, yung task force nga, if they're prepared naman in case that there are cases of monkeypox, meaning there is as an assigned people that will, if ever there are reported cases, Doc, or suspected cases that come in our country.
The importance there is that all of us, no, the healthcare workers or the doctors should be aware of that. No, in that memorandum, it put in important information. What are the cases? Who are the cases that when you suspect cases of monkeypox? And at the same time, there was also there on how to refer. You have specimens, or you have patients suspected with monkeypox, where to refer the specimens with the appropriate information in that referral form. And it should be disseminated, no? Not only for government, but also for the private healthcare workers, so that this is part of surveillance, because anybody can get to see some of these patients and without suspecting if it's monkeypox or not. And that's why it's important that when you have a patient presenting with fever and all those manifestations, especially the appearance of rash, first thing is that you have to inform and ask the epidemiological link. Have they had history of travel abroad? They had contact with persons diagnosed with monkeypox, or if they had known cases of monkeypox exposure while they are abroad. These are very important information for us to trace and suspect they are infected.
Okay, thank you, Doc Jean. We have another question, Doc. So if you have said nga, Doc, yung history of travel sometimes isn't necessary to diagnose monkeypox. Is it the immune state of the patient that also plays a big role in contracting the infection or manifesting the infection, Dr. Jean?
Okay, if you're going to look at the data from most non-endemic countries, no, in non-endemic countries where they had this patients with monkeypox, immune response, no, because most of those who got it are HIV positive, and in fact, half of those are not on antiretroviral treatment. So they are in the immunocompromised group of individual. So that's one. But again, it also matters a lot that it can also occur in non-immunocompromised individual. Okay, especially for those who are high risk, no? Who had been exposed to a direct contact with a known monkeypox, and so that's why communicating with our patients really entail explaining to them that every one of us are always at risk, okay? But there are more higher risk because of the risk of exposure and the immunocompromised status.
Okay, thank you, Doc. Another one, Doc. What do you think, Doc, is the cause of the atypical presentations in patients that are seen in non-endemic countries po?
It's difficult to really, that's an important question. No? It's difficult to really explain why they present with an atypical presentation. Is it because that they are immunocompromised, they are the HIV population, or is it because the behavior of the virus is different from this group of patients? Quite difficult to answer that. The important part there is that when we created this awareness, it seemed that we must go beyond the ability of looking at this particular infection into its classical manifestation to an atypical presentation. And that's where the high index of suspicion is important as a clinician. Okay? So that's why the challenge now among these non-endemic countries, since it presents with an atypical presentation, how will you be able to tell us that this is monkeypox or not? No? So it's in the history, in the way we will be talking to the patients with regards to the exposure, and of course the importance of the availability of a diagnostic testing, so that all doctors will be able to diagnose or test the lesions. No? So access to testing is also very important.
Okay, thanks. Thank you again, Doc Jean. So we have questions from our media partners, and we'd like to welcome our media partners from Net25 or Raja Aguila. Actually, they have some questions. One of it is, ano po ba ang bakuna laban sa monkeypox at ano po ang treatment ng isang patient? Is it pareho rin po daw po sa COVID patient na may antiviral po, and yung nga, may vaccine na po ba tayo available po?
Okay, thank you for that question. No, si Bel Sorara, no, from Net25. Thank you, Bel. Yes, Bel, no, there's a vaccine for that. No, kaya lang limited pa ang availability ng vaccine, and it's mostly available in the US and Europe, no. And currently, ang ginagawa ngayon sa mga bakuna ito, binibigay nila doon sa mga high risk for possible exposure. And these are as pre-exposure prophylaxis. No? Among the healthcare world, always be protected because they are the front line. No? So hindi pa yan siya readily available in most countries. There are antiviral agents just like COVID na available, but again, the data for that is still very limited. No? But they are using it now in some of these countries, among those who had monkeypox, no, and the outcome are more or less, there are good outcomes among those who were given the antivirals, no. So more or less ang magkapareho ito with COVID in terms of merong bakunang available, merong antiviral, although ang mga data are so limited yet, no, unlike COVID-19. So the treatment here is usually supportive lang, no? So bed rest and isolation. Of course, isolation is important.
Okay. For additional questions rin po from our media partners. Magkakaroon po ba ng monkeypox, or is it common sa mga bata rin po, Doc Jean, ang monkeypox?
Yes, no? So anybody is at risk, no? So it can be the children, the pregnant, the immunocompromised, no. But again, ang importante lang dito na yung risk will always be higher among those usually who are also exposed. In endemic countries like West and Central Africa, common talaga to sa mga bata dahil these are children who are into hunting, and trapping animals which are carriers, which are infected with the virus, no. But in non-endemic countries, it's not so common in children, and in fact, it's common among the 18 to 50 years, 45 years old who are sexually active.
Okay. So, Doc, we have a question on yung if you have been confirmed or suspected of monkeypox, what is the recommended isolation period? And a follow-up question to that is, what is the average time for the recovery from monkeypox? And how long does it really take until the virus is no longer detectable from a confirmed case, or they can no longer transmit the monkeypox infection? So
Okay,
three-part
so
yan, Doc. Sorry.
yes. Unang-una, the patient with monkeypox, yung classical case is usually you have to isolate them, no, for 21 days. Okay, and for them to be non-infectious already. The appearance of your rashes, it is the part that where most patients are highly infectious. Okay, so yung mga tubig or rashes, if you get to have contact with that and you have wounds or any mucosal contact, that can be a potential source of the infection. No? So ang longer ang isolation period, which is 21 days now. Ang tanong, how long will the patient be infectious? Okay. There are data that even after the disappearance of the rashes, when they did nasopharyngeal swab, there was still presence of the monkeypox virus. No, and remember, one of the mode of transmission of monkeypox is also respiratory droplets. So coughing and talking can also be part of that. No, but not as much as compared to a direct contact or close contact or direct contact with the patient. So there are insinuations that patients already passed the two to 4 weeks of the manifestation, and yet they were swabbed and they were still positive. There's a question if can they still be infectious? Okay, so it's difficult to tell if the presence of that monkeypox virus in the nasopharyngeal swab will indicate infectivity, but that's where it's important that it's always important for us that patients when they recover should still be wearing the face mask para lang hindi makahawa, no? And they can be lifted with from the isolation after 3 to 4 weeks, but they still have to wear the face mask to make sure na there are no shedding anymore of the virus. But less likely na yan, mababa na yung risk after 3rd week or 4th week.
Okay. Thank you, Doc Jean, regarding yung on the isolation and yung recovery period from monkeypox. So, siguro last 2 questions na lang, Doc, kasi there are some questions pa coming in. Pero from the media partners rin, Doc, if the patient had COVID and gumaling na sila, is it possible na madapuan rin ng monkeypox? Meaning, is there immunity daw if you have you had COVID, pwede ka rin ba magkaroon ng monkeypox rin at the same time?
Yes, no. I think it's always possible, no, because yung pag-develop natin ng COVID, wala naman tayong cross immunity, cross protection with another infectious disease. So it's still possible. It's always possible na makakuha ka rin ng another infectious disease, including monkeypox after your recovery from COVID.
Okay, Doc. Aside from vaccination, how do we prevent yung monkeypox infection or transmission? Will minimum health standards also be effective in decreasing transmission po and spread of the disease?
Yes, it's important, no? So halimbawa, there was contact, no? So you have to isolate the patient, and if you're exposed, you also have to wash your hands. You have to always wear your face mask. And in any case, you have a patient, no? Palagi itong sinasabi, kung meron kayong patient presenting with fever and rashes, always observe contact precaution and respiratory precaution, because we don't know what viruses or what organism are you dealing with, and both droplet and close contact will be potential mode of transmission.
Okay, Doc. one last question. This is the last question, and it's a lively question, Doc. Is it safe daw to resume sexual activities immediately after completion of isolation period from the monkeypox infection po, Doc?
Yeah. So there are data that the third to fourth week, the seminal fluid were sampled, no? And they found out less of the load of the virus. Okay. So I think ang bottom line pa rin dito, you still have to wear the protective condom, no? Just to make sure.
Okay. So protection is key talaga, Doc, no? So so sorry, I know that there are some questions pa po, pero due to the limited time, we have to continue on with our the health forum. So Doc Jean, we would like to thank you for your time, effort, and expertise regarding monkeypox. Is there any final message or take-home points would you like to say regarding monkeypox po, Doc? And before we go to
Yes.
our end.
So thank you, Kat, no? And thank you, Dr. Ginger, for this health forum. And I hope we were able to reach a lot of these people, especially the layman, which is the purpose of this health forum, to give them accurate and more important information, creating awareness about this emerging and re-emerging infectious diseases. No? And that's one of our mission in the Philippine College of Physicians. Thank you.
Oh, okay. So before we end this health forum, we now welcome our last but certainly not least speaker to give us our closing message for this health forum. We welcome the current treasurer of the Philippine College of Physicians. He's also the professor of the University of the Philippine College of Medicine, as well as the vice chair for postgraduate training in the University of the Philippines, Philippine General Hospital. He is also the past president of the Philippine Society of Endocrinology, Diabetes, and Metabolism, and also the founding president of the PCP Manila chapter. It is my honor and privilege to welcome Dr. Nemencio Nicodemus for our closing message.
Thank you very much, Dr. Tohino. It is indeed a very exciting morning. I'm sure a lot of our colleagues and everyone who has joined us in this health forum today learned a lot. We know that over the past several weeks, we are talking not just of COVID, but a lot of people are also very interested in this new virus, which is the monkeypox virus. In fact, it has been covered a lot by media, and we can see that from the questions that we have, it is really a very interesting topic. Luckily, this virus hasn't entered our country yet, as mentioned by Dr. Solante, and let us always keep our guards up. We know that once a virus enters our shores, then it can easily spread. But if we know about this virus, just as what we are doing now, we are increasing our knowledge about this virus and how to treat it. Then once this particular virus enters our country, if it does so, we will be prepared. So we would like to thank Dr. Solante for sharing to us his expertise on the knowledge about this monkeypox virus. Kailangan po talaga natin ng kaalaman, at ang kaalaman na ito ay may bibigay po sa atin ng mga eksperto na nagbibigay po ng tamang impormasyon. At kami po sa Philippine College of Physicians ay katuwang ng lahat ng ating mga media partners upang magbigay ng tamang kaalaman sa lahat, hindi lamang po sa mga manggagamot, kung hindi maging sa mga taong nangangailangan ng impormasyon kagaya po ng ating mga pasyente at lahat po na nakikinig sa atin. Sa ngalan po ng pamumuno ng Philippine College of Physicians, ako po si Dr. Nemencio Nicodemus Jr. na nagsasabing sana po mamuhay tayo ng ligtas at puno ng tamang kaalaman. Maraming salamat po.
Thank you again, Dr. Nicodemus, for your closing message. Thank you again, Dr. Jean, for your expertise regarding a monkeypox, an in-depth look. So again, thank you all for attending our first PCP Health Forum for this fiscal year. Hopefully, you can all join us in the following and upcoming sessions of our health forums because there are more to come talaga. Okay, so for those who have not been able to watch this fully, you would be able to see this in our YouTube page and our Facebook page. This is recorded also. So for further announcements, let me announce for the upcoming lay forums or health forums for the month of July. So we have on next Tuesday, July 26, we have one in 10 a.m., the Diabetes Awareness Week. Ang tawag nung health forum is Diabetes ay Labanan, Maging Mapanuri sa Kaalaman, with our guest speaker for that health forum, Dr. Charlene Ann Balili. And also, same day, 1:30 p.m., we have a health forum on the World Hepatitis Day. And the title of that health forum is The Burden of Hepatitis B in the Philippines, with our speaker, our dear President, Dr. Diana Payawal. And for the next, So we also have one on July 30. Again, at 5 p.m., entitled Burden of Hepatitis B in the Philippines. We are also happy to announce we are having our mid-year PCP convention this coming November 18 to 19 of 2022 at SBMA Subic, entitled Pandemics Aftermath, Facing Diverse Issues on a Renewed Internist Perspective. So if you have, I know we are short of time, and for questions, suggestions, and clarifications, you may also contact us in our social media accounts and our email. Thank you all for attending this in-depth look on monkeypox, and hope to see you once again in our upcoming health forums. Keep safe and good morning.
The Philippine College of Physicians, through the Committee on Media Communication and Health Forum, wishes to thank its media partners, social media followers, and participants. See you again next time, here on the PCP Health Forum.